My name is Daryl Stephenson, and I'm the ergonomist at the Hamilton Clinic for OHCOW. And today I'm going to be talking about concussions in the workplace. And I have a bit of a history with concussions and personal history with them. Before working at OHCOW, I played in the Canadian Football League, and I've been playing football since I was six years old, up until I was about 27 years old. And I had played 6 years, and I had 2 concussions during that time. I had them in my 4th year, and then ended up playing another 2 years after that without any real problems. But during that time, I really got interested in concussions and, the recovery, what I could do to help myself. I just wanted to be back out there playing and, as healthy as I can be and have as long as a career as I could. So I really looked into them a lot, and that led me afterwards to, when I finished playing football, I ended up doing a PhD and studying the underreporting of concussions in Canadian Football League players. So that's kind of my history with that. And since 2018, I've been working for OHCOW and doing a lot of presentations and trying to create some awareness about concussions in the workplace. So today I'll be going over basically what a concussion is, what to look for, some long-term effects, the underreporting of concussions, return to work, and prevention strategies. And ultimately, the goal is going to be to raise awareness, to provide an understanding of what people are going through when dealing with a concussion, and then to promote steps to take action to prevent concussions. And these resources are not intended to provide medical advice relating to healthcare. For advice on healthcare for concussion symptoms, please always consult a physician or nurse or qualified or regulated expert who deals with concussions, such as a physiotherapist. So what is a concussion? And this image here was actually created by Trevor, so thank you for that, Trevor, who just presented. The 5th consensus statement on concussion in sport was held in Berlin in 2017, and they described a concussion as a traumatic brain injury that is induced by biomechanical forces. And these biomechanical forces are acceleration and deceleration, and they may be linear or rotational. While a concussion is typically short-lived, the result can be a variety of symptoms that may vary substantially in severity across different individuals. So we can see here the head hitting up against a fixed object, and when it does, it creates a coup and a contra coup effect that I'll show on the next image that creates some damage or possibly contusion in the front and back of the brain. So here I have another picture that's labeled showing the mechanism of injury with the coup contra coup effect. And then I have a little video which gives a bit of a visual here that I'll click on. Great. So hopefully I have everyone's attention after that. One key unresolved issue is whether concussion is part of the TBI spectrum associated with lesser degrees of structural change than are seen in severe TBI, or whether the concussive injury is a result of reversible physiological changes. And the term concussion, while it's useful, was for a long time and still is somewhat imprecise. And because different authors or groups define them differently, a comparison between studies is sometimes problematic. And I would suggest always using the Berlin 2000 concussion statement, where everyone gets together and creates a statement. They've done that several times now, but the recent one is 2017, and it's a very good guideline for understanding concussions. There's been a variety of terms that have been used interchangeably, such as mild head injury, mild traumatic brain injury, cerebral concussion. There's also many slang terms used, especially in the sporting environment, such as being dinged or having your bell rung or seeing stars. And this also is used in the lay literature that we find. And when I was doing a scoping review for some of my PhD work, I ran into this problem quite a bit, where I had to use many search terms to try to find relevant sources about concussions. And slang terms may also have an effect of downplaying the severity of a concussion. So this is important to take note of in a workplace and be sure to use consistent labeling of concussion and concussion symptoms. So concussions have some common misunderstandings, and concussions occur when the brain is injured after a traumatic event, such as a blow to the head. However, you do not actually have to hit your head to suffer a concussion. And it's possible to have a concussion due to whiplash or rapid rotation, or shaking or jerking of the head, or even the body, where the impulsive force is then transmitted to the head. You also do not need to have lost consciousness to have a concussion. And very importantly, and in some cases, the signs and symptoms are very delayed and may evolve over a number of minutes to hours. So it's important to monitor the symptoms and not just assume you're okay if the symptoms don't occur right away. So we can see big lists here, and there's many common signs and symptoms that are associated with concussions, and the lists continue to grow. And there are many good lists available online that summarize this. But it's important to know which signs and symptoms to look out for, and posting them in the workplace can help create awareness. When I played in the CFL, they posted basically, but I think there were 8 foot tall posters with all the different symptoms, everything to look for, just to try to create awareness for all of the players. And if there's a bulletin board or something at work where you can post these, it's a great way to create some awareness about it. So some common signs such as headaches, dizziness, and nausea might be well known by most people, but something like having a lack of energy or concentration might be a bit more difficult to single out and attribute to a concussion event. So in the event of these red flag symptoms that we see over to the right, so anything like seizures or loss of consciousness, or any general fast-paced worsening of any of these symptoms to the left, these are considered red flag symptoms, and most of the information sites that I see now will use that term red flag symptom, and it should be treated as an emergency, and 911 should be called. And there's quite a large number of potential consequences, including problems with cognition, such as memory, judgment, or communication. There's also problems with movement ability, or strength, or coordination, or balance, or sensory issues, and social relationship issues. So basically anything that the brain is involved helping process potentially could have an effect on. So as this picture demonstrates, there are various ways a concussion is labeled, and many different symptoms and outcomes and ways to see it, and depending on what you're looking for. And it also could be a combination of many labels or problems. And I like this image just because it gives you an idea of the variability. So in general, with recovery, because the duration, the symptoms, the diagnostic testing, and the treatment in each case are so varied, concussions can be a very complex and costly issue to treat. It's very hard to predict the end result from the initial impact or the event that caused the concussion in the first place. So in that way, concussions become more about monitoring and reacting to symptoms that show themselves. Recovery from concussion is a process that usually takes a lot of patience. And if the person goes back to activities before they're ready, it's likely to make their symptoms worse, and their recovery might actually take longer. So recovery is typically from days to months, but it can last over a year. However, the majority of workers with concussion do return to work within 1 to 2 weeks following an injury. And in more long-term cases, you'll have early physiological symptoms like headaches that can turn into psychopathological issues such as anxiety and hypersensitivity and depression. And this is due to microscopic physiological changes that occur post-concussion that can have delayed secondary injury implications. So far, there's somewhat limited treatment options when it comes to concussions. And treatment for concussions traditionally has meant rest, which meant no visual stimuli, no multitasking, no physical activity, including sports, and no screen time. And back when I had my 2 concussions, that's what it was. It was basically sit in the dark, stay home, be isolated, basically, and rest as much as you can. And it also means being off work for people, and the length of time can vary from weeks to months. However, much research is being done on the benefits of exercise for those who can exercise without increasing their symptoms. And not only exercise, but really returning to activity when they can. I see more suggestions now that say rest for 24 to 48 hours, but return to activity as soon as it can be tolerated, and there's no risk for a second concussion to happen. So being isolated is also now becoming seen as a problem, and returning to work has benefits to people for the social inclusion and returning to normal activities and feeling like their normal self. Transient symptoms worsening with increased activity is common. However, the symptom worsening is significant or prolonged than a monitored, slower, progressive return to normal activity, and that should be implemented. And rehabilitation therapy may also be key during recovery and may include speech therapy, occupational therapy, physical therapy, or a combination of the three. And ongoing treatment options are being researched. However, there's no best practice yet for those who do not experience spontaneous recovery. And again, it's always important to discuss with qualified or regulated healthcare professionals. So just some general concussion recovery tips that you'll find. Resting, getting an appropriate amount of sleep, avoiding alcohol, recreational drugs, or any drugs that are not approved by a doctor, avoiding physically or mentally exhausting activities such as intense exercise, sustained computer use, driving, using heavy machinery until you're approved to do so. And then once you are ready, return to these activities slowly and gradually while monitoring your symptoms. And there are also many good recovery protocols that can help you keep track of your progress. And it is suggested that you would likely follow along with one of these along with other tips. So while most people do make a full recovery, there are some factors that have been shown to be more associated with poor functional outcomes. And a lot of these are individual factors that they might have pre-concussion, any pre-existing mental health difficulties, or pre-existing work injuries or dizziness coming in. But there are some that can be affected by the job itself. And these two I've highlighted at the end here. So reduced social interaction and job loss. And these can work with each other. So if somebody loses their job, they're probably going to have less reduced social interaction at work, where they got a lot of their social interaction. So those are two things that might be, a push to come back a little bit earlier when it's safe to do so. So symptoms of a concussion can be quite persistent for some individuals. Up to 80% of people who experience moderate to severe concussion symptoms may develop post-concussion syndrome. And though a consensus has not really been reached on the exact cause of long-term PCS, it's likely that biological, physiological, psychological, and social elements all play a role in symptom persistence. So suffering from PCS-related symptoms for an extended time may delay an individual's return to work, adversely affect their quality of life, their developmental trajectory, and result in additional social and economic costs. So post-concussion syndrome can also involve a cluster of symptoms. It could involve things like memory loss, headaches, vertigo, anxiety, depression, and fatigue, even altogether. There are some factors that may contribute to persistent post-concussion symptoms, including medication-induced fatigue, headaches or migraines, vertigo, deteriorated sleep hygiene, alcohol use, and depression. So these post-concussion symptoms can be particularly challenging, or persistent concussion symptoms can be particularly challenging for employers and insurers, as they are hard to prove for the average insurance company. You can have post-concussion syndrome, but all tests show that everything is normal. So the CT scan, you get an MRI, everything looks okay, but you're still unable to attend work. So it's difficult for sick leave insurance companies to adjudicate. Basically, your brain is shifted in a closed cavity, and these tiny shear forces cause the brain receptors not to fire in the same way they were before the head injury, but they don't show up on the scans. So post-concussion symptoms can impact memory, mood, and function, and it's very difficult to prove without any pretests, which the pretests themselves can be inaccurate or gamed, which I found a lot when I was doing my football research, that many of the players discussed, being able to game these concussion tests. So it's hard for employers to understand how a concussed worker is actually feeling, and there are no visible signs as there would be with a broken bone. There's also a challenge of identifying and monitoring one's own symptoms on a day-to-day basis. The symptoms can be quite confusing to monitor. And finally, the symptoms can return when returning to work. So even if they feel like they're getting better after a few days, they end up maybe driving to work and going through a commute and all the lights, the noise, everything going really fast, and some symptoms start to come back. Or maybe this takes place at the workplace. So this is why a graded process is done. It started in sports and now definitely in the workplaces I see this for returning after a concussion. So it's suggested that you need to basically reach different levels of activity without showing any signs and symptoms before returning to the next stage. So there are many mental health issues that can arise after a concussion, especially with these long-term persistent symptoms. So mood swings, irritability, anxiety, panic attacks, depression, low self-esteem, PTSD, and an overall lack of energy and motivation. So 1 in 5 individuals may experience mental health symptoms up to 6 months afterwards, and approximately 18 to 37% of people with persistent concussion symptoms develop depression in the first year after their injury. 1 to 2 years after the injury, this rate can actually double, up to 61% of survivors reporting depression. So basically, the longer the initial symptoms persist, the more chances a mental health symptom can happen. So feeling sad and frustrated are normal responses to the losses that a person would have and the changes they face after a concussion. And these feelings often appear during the later stages of recovery after the individual has become more aware of their long-term situation. So if these feelings become overwhelming or interfere with the recovery, the person may be suffering from something like depression. So when looking to help resolve some of these mental health symptoms, some suggestions include really finding the appropriate care that can help resolve the specific mental health symptoms. This may include multidisciplinary care in collaboration with a physician to co-manage the injury and the mental health symptoms. In more serious cases, additional support may be required from a psychologist or a psychiatrist or social worker or other mental health professionals. Follow-up care after a head injury, even for mild cases, is very crucial, especially for patients showing factors for PTSD or depression. And then educating and reassuring the patient or the person by a trained and knowledgeable healthcare practitioner, giving them hope and keeping their spirits up, are some of the evidence-based treatments that we found for persistent symptoms. So there are other future concerns that are linked to brain injury, such as Alzheimer's like dementia, Parkinsonism, motor neuron disease, including ALS. And findings of a study from the Institute for Clinical Evaluative Sciences and Sunnybrook Health Sciences Center found that adults who experienced a concussion have a long-term suicide risk that is 3 times higher than that of the general population. And an interesting finding was that the risk increases by a further third if the concussion had occurred on a weekend. Uh, and in a study on retired NFL players, they had earlier onsets of Alzheimer's disease. Players with 3 or more concussions were 5 times as likely to report mild cognitive impairment, threefold prevalence of memory problems as compared to players who retired without any previous history of concussions, and they had neuroimaging abnormalities and differences in brain metabolism disproportionate to their age. So chronic traumatic encephalopathy is something that you've probably heard a lot of in the news. It's also called CTE for good reason. It's really hard to say. So CTE is something I'll briefly touch on, and it's a neurodegenerative condition that is thought to have been brought on by repetitive blows to the head or concussion-like events. CTE was first associated with boxing, but it's recently been found in other cases of repetitive head injury, including former football and hockey players and professional wrestlers. And to test for it, the person has to have died. So it's a very tough thing to figure out right now. But CTE can show up many years later in life and cause many complications day to day. And many different biomarkers are being studied, but currently one main theory is that tau proteins after injury are being remodeled and entangling around neurons in the brain in a very unique pattern and causing them to die over time. So second impact syndrome is something that definitely needs awareness and the spread of awareness for this particular problem. And second impact syndrome is a dangerous problem that's caused when a second concussion-like event happens to someone who has already undergone a previous concussion while still having symptoms. So at this point, the brain is more susceptible to a second injury and can swell from damage. If the second impact happens, it can lead to worse symptoms, further brain damage, or even death. And for this reason, extreme caution is needed after any concussion-like event, regardless of the severity. And this is actually in Canada where Rowan's Law has come from. It is now recommended that immediately following a concussion, people should be provided with recommendations to avoid a second concussion, particularly in the first 7 to 10 days post-injury. So if somebody's coming back to work after a concussion, that first 7 to 10 days should have no activities that can involve getting a second concussion. So now looking at what causes concussion in the general population, the most likely events to cause concussion are vehicle accidents, falls, sports and recreational activities, and assaults. And the Institute for Clinical Evaluative Sciences analyzed provincially collected data and found that there were 148,710 diagnosed concussions in Ontario in 2013. And now looking at some statistics for traumatic brain injuries before I go into concussions, because that was originally what they were overall grouped as. So this has been a trend as far back as I could find. In a cross-sectional study using the comprehensive data set of Ontario Trauma Registry from 1993 to 2001, 7.3% of all traumatic brain injuries were work-related, and there was a 12.4% increase in the total TBI during that time. And according to data from the WSIB, there were 1,644 claims requiring time off in Ontario in 2012, which is up from 790 in 1996. And according to the Public Health Agency of Canada, traumatic brain injuries will be the most prevalent neurological condition by 2031. So now more specifically with concussions, it was found that there is an increased trend again in the number of concussion cases that are being reported. So there's also a likely increase in the awareness, just in general for people of concussions due to sport concussions, people like Sidney Crosby and Eric Lindros, and the concussion movie with Will Smith, and all the media reports. So prior to 2010, 50% of brain injury claims filed with the WSIB were for concussions. However, by 2013, this number had risen to 80%. And the number of time loss claims for work-related concussions increased by 371% in Ontario from 2004 to 2013. For some more recent numbers, these two charts show the concussion claims accepted by year, count, and cost. So on the left, we have the amount of claims that were accepted, and on the right, we have the cost of that. So we can see from 2012 to 2019, there was a steady increase in both concussion claims accepted and total cost. But in 2020, the numbers did go down. However, this was during the pandemic, which may explain some of the drop in numbers as people were working from home or off work. However, in 2021, they were slightly on the rise again. And in 2022, it seems to be a little bit higher numbers, but I actually do not know if this is the entire year or the fiscal year. So we might be missing some months. I know it did end in December of 2022. So in the workplace, the highest rates for concussions are in the industries of transportation, storage, government and primary industries, forestry, fishing, mining. But there's also many in service industries, including healthcare and the construction industry. But they can basically happen wherever, even just a fall or a slip can happen. So the main causes of work-related concussion will vary by industry and occupation. However, some of the more common causes are slips, trips, and falls, being struck by or against an object, such as a falling box, motor vehicle collisions, and in other cases, students, customers, patients, or coworkers might strike an employee and assault them. So there are some common steps to take if a worker has concussion symptoms or had been in a concussion-like event. So definitely alert a supervisor and report the incident immediately, and seek a medical assessment as soon as possible. Do not try to diagnose yourself, or do not try to diagnose a coworker. Always have a professional do this and walk you through it, and be aware that there's delayed symptoms, and that's why it's always good to go seek medical help as soon as possible. But definitely report the incident. You want to know what happened, and you want to be able to look back. You might not have symptoms, they may be delayed, and you need to be able to prove that the event happened. Do not drive or be left alone. Don't let them drive home and say that they're okay, because you know that symptoms can arise, especially when they get into a busy commute. You want to try to give water, juice, or any food that they can eat while they can tolerate it. And one common thing that we've seen, and I was involved with some research on nutrition with children at Western, and they discussed a lot that after concussion, people don't want to eat. Oftentimes, one of the symptoms is nausea, and you don't want to eat, but your brain needs a lot of energy to repair itself and to help itself. So as soon as possible, get yourself some juice or whatever you can tolerate. And then consult a healthcare professional as soon as possible to help manage the ongoing concussion. And again, if there's any of these red flag symptoms, or the person's unconscious or has a seizure, call 911. And then if you need further information, call Telehealth Ontario. So although education is important and awareness is increasing, there's still a lot of confusion around concussions, and there is also intentional underreporting of concussion symptoms that occurs. So in a study among emergency department patients, 88.6% of the respondents who experienced concussion injuries reported that they didn't recognize that they had suffered a concussion. Concussions are often underreported across sport and across workplace contexts, and they are so for a number of reasons. And so although they're caused by a physical trauma, concussions are an invisible injury that leaves no visible evidence. So if you come into work and you have a broken ankle, it's pretty easy to say, I can't do these certain things. But with a concussion, you really can't tell what a person can and cannot do until you go through some tests and see if symptoms arise. So assessment is not as simple as testing for swelling, pain, or strength, but rather it requires an evaluation of self-reported symptoms. Okay, this self-evaluation can be difficult. For instance, what does feeling like you're in a fog mean to you? Because for a while that was one of the symptoms in the symptom checklist. So if you were to think, what is feeling like I'm in a fog? So we went to different classes at Western and asked the students some of these symptoms and said, how would you interpret this? And there were quite a few different interpretations, especially for that one, feeling like you're in a fog. And then the concussed person may not be in a good position to be assessing themselves. They may have had problems sleeping and concentrating, and really trying to focus on what is different about themselves might be pretty confusing. The person may also assess the event that caused the concussion and conclude that they could not have had one from that event. So they might have thought, well, I didn't really get hit in the head. I didn't get hit very hard. I've had worse. I don't really have a lot of symptoms. Or they may test themselves with poor techniques, such as trying to remember certain things like the dates or the names or the locations. And then if they can get those right, they might assume that they're okay. And some other reasons that concussions are underreported is that people may develop assumptions about how concussions will affect them, or only attribute past concussion symptoms to a possible current concussion. So they may not have had a headache this time when they did on their previous concussion, and they may think that their lack of concentration does not actually have to do with the concussion. They may be uncertain of the strength of their diagnosis, and really they're uncertain about what the true risk is to continue working. So some people may work through concussion symptoms if they're not drastic enough. So maybe they have a minor headache after work and it may not be a cause for concern. Or they may be taking painkillers, possibly for like a lower back injury, that may mask some of the symptoms, such as a headache. And there are also social identity issues. Depending on the workplace, this can be external pressures or cultural pressures, maybe to work through an injury. And maybe some of these pressures are manifested internally, trying to assume what others may expect from them. They may also have a history with concussions and may not want to reveal this. They may fear job loss or have low job security or have financial concerns, possibly a self-employed worker who gets paid by the hour and who doesn't want to take time off for a concussion. There are also deadlines and work goals that can influence them to not report. Maybe a big project is going on that has a real tough deadline, and they know without them this project won't continue, so they may work through it. There's stigma in the workplace or the normalization of symptoms, such as having maybe headaches after work. So it's possible maybe they're working in an environment that has very bright lighting, causing frequent headaches after very long shifts. And if they have a concussion-like event that day, they may not attribute the headache towards it. And also, just having the delayed symptoms that they do not notice right away. So symptoms may return later that day, not necessarily during the activity. And again, this stresses the need for reporting incidents immediately and taking preventative actions. So when returning to work after a concussion, a worker returning prematurely may be put at a serious risk. Even with good intentions, you may be unintentionally pushing the worker to activities that may be too demanding or stressful from a cognitive perspective. And the employee may be leaving very exhausted. They may be forgetting things or doing things without their required mental capacity. So in a study done in the UK, a group of workers had sustained mild to moderate TBIs, and they reported some of the important issues they faced were the invisibility of the injury, continuing symptoms affecting their ability to do their job, a lack of evidence or a lack of advice and guidance on returning to work. And in addition, the return to work support systems were considered to be poorly coordinated and managed. And there are some common steps that we see returning to work after a concussion. It's generally started with rest. And again, that's been condensed now to more 24 to 48 hours. And if you don't have symptoms, try to return to a light activity. From there, you'll increase your activity gradually, further returning to a modified position at work. And when that's okay, and you can take that without any symptoms progressing, then you can return to the regular position, but with some caution and accommodation, maybe flexible hours, and then return to regular duties when you fully can. And all of these steps are going to require frequent monitoring of symptoms. And each stage is typically a minimum of 24 hours, but it could take longer depending on the activities and the effect and how they make you feel. But return to work can also vary depending on the type of work and how physically or cognitively demanding it is. And you also may revert back to previous stages if symptoms really persist. So when accommodating for a worker who had a concussion, there are some considerations to take, such as creating restrictions on dangerous jobs, such as climbing or using ladders or anything that can cause that second concussion. And it may be helpful to provide a calm, quiet area where the lighting can be lowered if needed, or a place to rest, or the sound can be reduced. It's also important to ensure a plan for a safe commute to work, and that's very important. Providing flexibility in job tasks and hours worked. And when prolonged post-concussive symptoms pose a barrier to return to pre-injury employment, introduction of other meaningful activities that facilitate recovery should be considered. So other employment, full-time or part-time, educational activities, community roles, and activities that promote community integration, such as volunteer work. And these may be considered as an alternative focus for meaningful activities. So accommodations should be made is necessary to facilitate the identification of restrictions where there is a risk of re-injury and to provide appropriate accommodations by clearly identifying the symptoms and functional limitations of the person. So whether they are physical, cognitive, or emotional limitations. A doctor may recommend the employee avoid activities such as driving, heavy lifting, or working with machinery or working from heights for a period of time. It may be important to reduce the physical and cognitive exertion. The worker's thinking, speech, and reaction times might be slowed, and they may be less able to concentrate. They probably won't be as productive as usual at first, and their job tasks may need to be altered. So incrementally over time, the employee should be able to return to normal work and over this gradual process. So this may include things like switching the jobs from a physical job to a sedentary desk work job, and then gradually increasing the amount of hours worked per day or per week. And it's very important to obviously take the condition seriously, but it's also very important to be positive and reassuring with the employee about their recovery. And this kind of goes back to some of that prolonged mental health symptom problems. The injured employee may be in a vulnerable state. They may be scared and upset by the symptoms and very worried that they might worsen in the future. And this anxiety just makes the situation worse. So you really want to reduce any stigma surrounding concussions in the workplace and always try to be a positive reinforcement. So when preventing concussions in the workplace, ultimately we want to try to remove any hazards. So key findings from a study on TBI showed that nearly 80% of injuries were perceived as preventable, and nearly 25 to 50% of these workers over different jobs reported that they did not receive job and health and safety training. So the vast majority of injured workers considered their workplace TBI to be preventable. In addition, they found that training and supervision are two areas that can be targeted by prevention strategies. So when looking to prevent concussions in the workplace, we want to remove any tripping hazards. We want to make sure walkways and workspaces are free of clutter, cords, puddles of water, anything else that can cause a slip, trip, or fall. I've even seen suggestions to create a slip and trip map so you can list hazards around the workplace or hazardous areas that might reoccur. And then use proper signage to alert employees of wet and slippery surfaces. Keep shelves and storage areas in your workspace clean and organized to avoid falling objects. In warehouses or storage facilities, place the riskier objects on the floor or the lowest possible shelving. Wear the proper type of safety footwear to prevent falls if you work in a slippery, icy, or other rugged terrain. And then keep increasing the training and supervision of everybody. Then some more general tips include not standing on things that can cause a fall, like a chair, desk, or a table, but always use an appropriate step stool, access platform, ladder, handrail, etc. Use caution when working from heights and know how to use your fall protection and fall restraint equipment and make sure that's tested before you go and actually use it. If a job requires wearing a hard hat, make sure it's appropriate for the job, it's properly fitted and in good condition. And ultimately remember that helmets can help, definitely with that first initial hard force from a hard object to your head, but concussions can still happen. And we can see this with football, and they keep improving the helmets, but concussions still exist. So just keep that in mind that they're very helpful, but concussions can still happen if you have one on. And then report all unsafe conditions to the nearest supervisor. So there are many validated tools that can be used to measure post-concussion syndrome. And I'm not going to read these all, but just know that in general, these are lists of symptoms that the user uses to show what they're experiencing. And I'll show one example here. And this is the Rivermead Post-Concussion Symptoms Questionnaire. As widely used, this is actually the one. So the WSIB has a concussion program of care that you follow. So once you have an accepted claim, you go through this process. It's generally 2 4-week blocks of treatment, and you'll be taking this Rivermead Post-Concussion Symptoms Questionnaire. And this allows you to compare your concussion symptoms over time and before the accident. Now, I've compiled quite a few resources that I keep updating on here, and just some helpful links that I've put together to provide further information on concussions and where I got a lot of this information from. And this list has a lot of links to concussion information, but also to workplace prevention links. And we'll be sharing the slides afterwards. These presentations go online. And if you still can't find it that way, or it's hard to type these in, then you can always email me and I can send you the list. So that's kind of it for the concussion section, and I'm just going to be going over now towards more of the prevention section. So today I'm going to be going over an app that the OHCOW and CCOHS has created called Hazard Assess. And this is one of the suite apps created with similar functions and goals as some of the others that we have, Stress Assess, Air Assess, and Pain Point. So research out of Belgium discussed levels to the identification of hazards, starting with the most common. So about 60% of hazards will be identified at the screening level, where the worker identifies hazards based off their firsthand experience. From there, it tapers down towards more expert opinion and analysis. So OHCOW and CCOHS has created these apps to really fit and to get in the hands of workers in the front line or the Joint Health and Safety Committee going around trying to find hazards in the workplace, and just to really give that frontline experience and allow them to report it back. So this app allows you to take action to reduce or eliminate the health and safety risks in your workplace by guiding you through 12 distinct health and safety topics, prompting you to describe the hazard, identify the source of it, to provide your own ideas and suggestions on how to fix it. And it also allows you to take pictures and mark them up with circles and arrows if needed, and then create a PDF report, which can be emailed to your organization's workplace health and safety contacts for a follow-up. So here's the general topics that it would cover. So ergonomics, physical conditions, unsafe conditions. So this is where the concussions would come in, workplace stress, air quality, radiation, biological, chemical, working alone, and driving hazards. So this is a mobile app, and you'll bring it up on your phone, and basically this would be the first page where you select which hazard you're identifying, and then it'll proceed to the next screen. So on here, you're going to be able to rank how concerned you are about the hazard and how detrimental to your work it is if it's interfering. Then you can write in the boxes the exposure details, provide some suggestions, and then create a picture for it. And this is my coworker John, who's worried about the piles building up in his workplace and them falling on him, and his suggestion is to go paperless. So from there, you can create a PDF of this report, which will show up just like this and show the hazard. You can label it, you can circle problems, you can say this part of the floor is slippery, this machine keeps leaking, etc. And then keep an ongoing list of these. Furthermore, if you need any more information about the specific hazards, the links at the end of this will send you to both of our websites where you can read as much as you want about those topics. And just a side note, this is available for Apple and Android phones. However, right now we have some issues with the Apple store, and we're just working to get it back up on it. But that should be up at some point. So just overall, a summary, I thought, what do I want everyone to know when I leave this presentation? There's a lot of specifics in there and a lot of things you can look up, but just in general about concussions, I wanted to say that they can happen in various ways. Concussion symptoms are unpredictable, they're highly variable, and they can develop over time and lead into mental health problems. You definitely want to remove a person from a work activity immediately until a proper diagnosis has happened, as soon as you see any concussion-like event or anyone's reporting any symptoms. You want to seek professional care for the management of concussion recovery. You want to be cautious and caring when dealing with a suspected concussion. Have an understanding of what the person may potentially be going through and why your support really matters. And then develop plans to promote awareness and to reduce the risk of concussion events in the workplace, and to do this by involving workers in the screening for hazards and developing preventative solutions. So if you have any questions, I'm sure I'll see some in the chat, but if you have any more after, please feel free to email me at dstephenson@ohcow.on.ca. Thank you.
Thank you, Daryl. That was spectacular. Very, very good job. First question, Daryl. Are the issues similar from forward and back impacts as they would be from a side-to-side impact regarding concussions?
They're so variable that it's hard to say that, but what I have seen in the science literature is that the rotational ones are actually worse. So in general, the rotational ones cause more problems.
What do you mean by rotational?
So if you were hit in the side and your head rotates really fast, and that does cause more problems than the hit front to back. However, I think that it's very variable. So I I can't answer if the back would cause more, but I would assume it probably would, because to have that effect, you'd probably need a harder impact. But that's me assuming.
Okay, yeah, tough question. It's not an exact science, concussions, is it? Okay, I believe you answered this in some form during the presentation, but I'll have you give it a go again. What are some methods that can be used in the workplace to help people with concussions return to full regular work duties?
So definitely having the workplace provide accommodations is one of the biggest ones. So when I talked about things like lighting, maybe giving them their own room for a while. And I have seen that recently in workplaces where somebody who had a number of concussions actually had their own room. So they could set things up, they could reduce the noise, and allow them to work in their own conditions without having things pop up. So things like that can really have a huge effect. I remember when I had my concussion in the CFL, even just doors shutting was very loud to me, and things like that can really throw you off. So, very much accommodating, figuring out what their limitations are, talking with the person, talking with their doctor, seeing all the reports, and really trying to build a safe environment for them around that.
Okay, thanks. Before we get to the next question, just a reminder to everybody to please complete the survey that is on the Slido thing, so that we can get further information from you as well. What's the other next one here? What are your thoughts on baseline testing to help diagnose concussions in either, the sporting or the workplace world?
Well, I have seen conflicting things on baseline testing, and definitely from talking with players, knowing how to kind of game those systems. And I have seen things saying not to baseline test kids, but I don't exactly know all the science behind that. So I would stick with whatever work protocol you've come up with if it's based on, one of the links that I provided, like Concussions Ontario. But baseline testing, I have seen some controversy over it. I would think it would be a good idea, but again, it's not always perfect.
Okay, thanks.
Sorry, it's a bit of a vague answer.
Well, again, I don't think that this is an exact science here with concussions. It's kind of a new thing, and we're really not too sure. Are females more vulnerable to the effects of concussions, either acute concussions or chronic concussions?
I'm not sure if they're more vulnerable. I have seen some stats that say they have more concussions. Um, I'm not sure if they're more vulnerable in that.
Okay.
And especially to the long-term effects, I don't know that answer.
Okay. To what extent does chronic exposure to vibration or shock waves, such as somebody working, in explosives, potentially contribute to the onset of concussions?
That's a really good question, and it's something that's actually I've talked to some people that work in the mines, and they've brought this up and said, we need to look at some of these areas because we deal with these shock waves and these blasts, and some of them knock them off their feet, and if they're not far enough away. So for sure, I think there's probably some connection there. I don't know 100%, but all the mechanisms would make sense that there would be.
Okay. The next question I have here is, and you may have said this, but I think I may have missed it as well. When does a concussion become post-concussion syndrome?
So if the symptoms persist for a number of weeks to months, that's generally when it starts. So I think it would be over a month that it would be. So the WSIB, their system has you in 2 4-week blocks when the expected recovery is supposed to happen, but that can be extended for certain situations. So I would think it would be after at least a month.
Okay. Well, one directly ergonomic one right here in the chat that I just happened to notice. Any recommendations or comments on providing alternate screens or monitors for return to work of post-concussion employees?
Yeah, so I've definitely seen things on screens, and not just screens, but glasses to wear to reduce lighting. There's also some rehabilitation glasses, such as prism glasses, that I've seen recommended. I don't know exactly how well these are, but basically, if you're having problems with brightness or just focusing on the computer, it might be a good idea to try something that might reduce it. I'm sure there's things that you can do within the monitors themselves if they're good monitors, but also putting something on a screen like a lens that can dim the light a bit can definitely help.
Okay, one other one that Val posted here, that was from off the feedback or the Facebook feed. If a worker has several concussions over their lifetime, could symptoms, the ones listed on the Rivermead questionnaire, be continuous or intermittent?
Well, generally, you will get you'll get through the recovery of your concussion, and if you have another concussion after that, it might have different symptoms or it might have the same symptoms, and that's one of the problems that I ran into with doing my research. A lot of people were like, "Well, I didn't have a headache this time, so it wasn't a concussion." So understanding that these symptoms can evolve and turn into other symptoms. So whether they're continuous, yes, they could be continuous if they're prolonged and persistent symptoms, or if you have a similar concussion-like event and it causes the same symptoms, and they can come and go for quite some time.
And I guess that, I mean, that leads to my personal question for you, is that not all concussions symptoms are similar, right? Like they're different every time for every person. Is that like,
Yeah,
can like
and
explain
even
that a little bit better?
yeah, so they're different every time for every person, and they're different with that person themselves. So just because you had a headache the first time, doesn't mean that you're going to have a headache the second time. And that was one thing that I saw a lot within the literature and in my research, that people sort of get this idea that a concussion is individualized to them, and that it should appear a certain way, which may make them not see signs and symptoms that are concussion signs and symptoms as a concussion, and that's definitely a problem. So that's why always creating those big lists of signs and symptoms and making people aware of them, and understanding that their symptoms can change and be different from previous ones, and it's very variable depending on how the event happened, who the person is, how they're physiologically, psychologically, how things progress.
And that's kind of the difficulty with concussions. It's not like, we have certain tests that we can, we we put you through a test and we can tell whether the medial collateral ligament on your knee is torn or not, right? I mean, and
Exactly.
it's a pretty decisive test there. It either
Yeah.
is or it's not, or it's partial. With concussions, it's so variable. That's kind of why you have that big, huge list, right? So
Yeah.
thank you, Daryl.